Castellano says that's one main reason behind this new trend. Less expensive, less invasive cosmetic face procedure.
So she turned to Dr. Richard Castellano for an image lift.
Thanks to Dr. Castellano, and I just feel like $1 million. I know.
Dr. Castellano says he's seen a spike in patients like Elizabeth who feel they are being discriminated against because of their looks.
Ladies and gentlemen, please give a big round of applause for Dr. Rich Castellano.
Please, let's give a big hand for our team who put all these amazing things together for us today. What a big party! Wow! We're so excited that you're here today, and we are so grateful for the opportunity to serve. And we've had thousands of patients come through to hear about the future of plastic surgery. And it's so humbling to hear patients come back and share their stories and what a difference it can make in their lives. We have such a wonderful team here. I'm so excited for you to get to know them and to hear from our patients, because what we do is very special. I'm going to ask you a simple question: is do appearances matter in our relationships or in our workplace? Do people judge us differently based on how young or how old they think we are? Who is the most important person that treats us differently based on our appearance? Ourselves. And I hear it all the time from patients when they say they look into the mirror and they just feel that what they see does not reflect what's on the inside. If we're lucky, aging keeps coming, right? Okay. So as a double board certified facial plastic and reconstructive surgeon, I'm here to share with you what can be done that is safe, that's effective, and you must look natural. I'm going to have you say that back to me. You must look natural. Yes?
Yes.
So it's very humbling to perform cosmetic procedures on patients from all across the country and internationally. And I have doctors who come to me or I go to them and teach them about the latest techniques in the future of plastic surgery. And one thing that I have discovered is that there are no cosmetic treatments that will ever look as good as Mother Nature's free facelift, or smile. Do me a favor, turn to who's next to you and just give a big smile. Give a big smile. Don't we look nice when we smile? Hey, Arlies, can you just check on the cameras that they're doing fine? Can you guys just check on it? The cheeks plump up. We look so good when we smile. And I can't beat that, right? There are 4 categories we address to help our appearance look better. And you should write this down. Number 1, if we sag, then we tighten. If we sag, we tighten. Number 2, if we lose volume, then we fill. We're just putting things back where they already were. I have 3 kids. I have a 14-year-old daughter, an 11-year-old son, and a 10-year-old son. And what are we telling them all day long? Put that back where it belongs. So we're just putting things back where it belongs. If it sags, we tighten. If we lose volume, we fill. If we get sun damage, wrinkles, and sunspots to the skin, we polish and repair the skin. And the 4th category outshines everything else, and that's our behavior. Like we said, nothing looks as good as a smile. So I can help you look younger. If you want to look more attractive, you smile. If you want to look younger than what we can achieve with the cosmetic treatments, then you just have to act immature. It works, right? So we will help you with your appearance, we will help you behaviorally. But the smile is so important because you can measure people's smiles now. Did you know this? There's a smile score, 0 to 10. Some people, they smile. No matter what happens to them, well, looks like I got a flat tire. Some people, no matter what happens to them, they never smile. When we walk into a doctor's office, what's the average smile score? 0 to 10. 10 is a lot, 0 is nothing. What is the average smile score for that doctor? I heard an 8, I heard a 0, I see a 4. Sometimes it's high, most of the time it's kind of low. 4, right? What smile score do we want from that doctor for the best customer service and the best patient experience? We want to be high. Is it really that hard for these people to smile? Does their appearance influence what we think about them? How much we trust them? How much we think that they care about us? Right? We're going to do a little exercise. It's very important, and it shows you the power of our appearance and the power of our smile. So what I'm going to have you do is I'm going to have everybody stand up, and you'll need a partner. When you partner up, one partner puts their hand up in the air, and the other partner hands down. So when you've got your partner, would everyone stand up, and my team will help you if you need a partner. Now, here are the rules. If your hand is up, you are the smiler. If your hands are down, you are the poker face. Smilers, your job is to get them to smile. Poker face, I think she needs a partner over here. Poker face, your job is to not smile. So see if you can do it on 3. Ready? 1, 2, 3, go. Can you get them to smile? There's some tough poker faces out there. You have to get a little crazy. All right, give yourselves a hand and switch up, switch up. If you're the smiler, now you're the poker face. If you're the poker face, now you're the smiler. And see if you can get them to smile on 3. Ready? 1, 2, 3, go. Can you get them to smile? All right, good job. Give yourselves a hand and please have a seat. Now, what just happened there? Were you able to get them to smile? Were they trying not to smile? I mean, we can force people to do things that they don't want to. If you're good with your appearance, if you're good with your smile, we can encourage people even if they don't want to smile. Our appearance is so powerful. And my job is to help you look younger, tightening volume skin, and sometimes to help people look better, I give them smile homework. Let me ask you a question. If I do a consult with someone and I cannot get them to smile through the entire consult, what do you think the likelihood is that they're going to smile after we do our very best work? It's pretty low. So I have to have an honest conversation with that person and say, you know, I'm not sure this treatment's going to be right for you. I don't know if it's going to give you enough improvement to make you happy. Really? I just want you to be happy. So the smile is important. Now, during the consultation, I ask everyone to smile because that is our model. Smile in the mirror. So we look in the mirror and we smile and you see how it plumps up the cheeks. That looks so good. It gives us some volume. It tightens things up. It relaxes the wrinkles through here. That's Mother Nature's free facelift when we smile. But what I've noticed, some people, when they smile, they do something very interesting. This is how some people smile when they look in the mirror. They look in the mirror and they put a smile on their face and they go like this. Like they're really trying to get it out. It doesn't come so easily. Some people I ask them to smile and they start laughing. Just so quick and easy. But some people really have to get almost like a running start to make it happen. And then I realized that some people have a debilitated smile. They just don't smile that much. Our appearance is so powerful. People think that plastic surgery can be about vanity. Vanity is when we use our appearance negatively. If we put other people down, or we put ourselves down with our appearance, that's what I call vanity. But when we use our appearance positively to inspire ourselves or inspire other people, there's a word for that, and that's called style. And that's what we love to do. We love to bring out your personal style. We love to celebrate you. Style is powerful. Style is fashionable. Style never goes out of style. Okay? So that's why we're so excited to be here and share with you what we do. So 4 areas, we tighten, give volume, polish the skin, and then behavior. And there are 4 principles within each one of those categories that we must follow. Number 1, you must look natural. We went through that. Number 2, safety. Number 3, prevention. If we're lucky, Aging keeps coming for us, right? It's better than the alternative. And preventive, we can prevent future aging changes. That's a positive thing. And number 4, give you as much improvement as possible. Now, what I've noticed too is when we look into the mirror, you ever notice how some people can be a little hard on themselves? You ever seen that before, right? Or maybe you know someone really well who's kind of hard on themselves. I've had patients come, they look in the mirror, and I ask them, I like to hear it in your words where your focus is. That way I know we're addressing what's important to you. And I've had a patient tell me, oh my goodness, my face, it looks like a dog's rear end. I mean, they just get so hard on themselves. And I gotta say, wait a minute now, don't be too hard on ourselves. We never see ourselves the way that other people see us. You know what I'm talking about? Why is that? Did you realize we look at other people differently than we do it ourselves in the mirror? When we look at other people, we give them a little facial expression. How are you? Good to see you. A little bit of a smile, but we express ourselves. Did you realize when we look in the mirror, we go flat like a cadaver? We just go, there's nothing there. Just looking, scrutinizing. If you look at someone flat like a cadaver, they say, what? Are you mad at me or something? It's rude to be flat with other people. I don't think we should be flat with ourselves. But did you ever notice if you give yourself a little facial expression in the mirror, people think something's wrong with you. They say, what are you doing? Right? It's silly. But it's okay to be a little bit silly, as long as we're not too hard on ourselves. Now, I have very high standards. And I love meeting patients that have very high standards. But if our standards are too high, there is a risk that you choose a cosmetic treatment that goes too far. And most people don't want that. Sometimes people tell me, no, I want to look like I've been facelifted. That's not that common. I try and talk them down. Nobody really wants the Joan Rivers look, God rest her soul. Joan Rivers would joke that her face was pulled so tight that if she would sit down and cross her legs, her mouth would pop open. Most people don't want that. So perfectionism in plastic surgery is not a good thing. Because even if you achieve it, it's not attainable. But if you make something perfect, or if you say gone, take away, or get rid of completely, it looks unnatural, and then people can't stop looking. They don't see, it doesn't look quite right. And we don't want that kind of a response. All right? So we're going to go through today what we can do. And is the little clicker over here? Is that in the back? So we're going to talk to you and show you our before and afters. You've got our book. We are very proud of our book. It hit the Wall Street Journal bestseller list. And patients read that many times over. So you've got the book. You'll hear from our patients. Is it over on this side? Oh, is this it right here? Okay, here we go. It's right here. Oh, thank you very much. Thank you, Stephanie. So we're glad that you're here. Now, the power of smile. Now, here's Judy. Judy's a patient of ours, and she's a good smiler. Judy is a family woman. Now, Judy was a caregiver for her parents. Has anyone here ever been a caregiver before? Is that easy being a caregiver? It's stressful, frustrating, around the clock, hard to get a break. Judy did this for her parents for about 20 years of her life. Now, it was nice that she could be there for them, but it takes a toll over time. Now, when her parents passed away, unfortunately, her husband fell ill, and she was his caregiver for an additional 10 years. When Judy's husband passed, she made a confession to her daughter. She said, you know, I don't really know who I am anymore. She felt like she had lost her identity. She was always living for someone else. That day, Judy made a very important decision. She looked into the mirror, and as she looked into the mirror at herself, she saw that she had some aging changes. And as she was looking, she pulled back on her neck and jawline, and she liked what she saw. Does anyone here ever do that at home? She liked what she saw. She came into my office. I will never forget meeting Judy for the very first time. You know how when you meet people that have been through difficult things in life, that the little details, they don't tend to bother them so much, right? She was very centered, very quiet, very humble, been through the experience as a caregiver. We talked about her family. We talked about her goals. I sit people in front of the mirror and I did the pull. I asked her what her goals were. She said it was the neck and jawline. We did the lift. She said she liked that. I said some get a little bit less, some get a little bit more. If we need to come back another day and do more, that's better than going too far. Her daughter was there with her, and she gave her daughter the look over the shoulder, kind of saying, "What do you think?" And her daughter was very supportive. She said, "You go for it, Mom. It's your time." So Judy did a laser image lift, a laser tightening plus the lifting procedure. We did some eyelid treatment and we did some filler in the cheek. And here are her results. Thank you very much. Thank you. Looks natural. Notice the jawline and the cheeks. You see the tops of the cheeks? That's filler. There's no surgery in the tops of the cheeks. But we did office-based procedure for the neck tightening and a little bit of the eyelids. And it looks natural. Now, I love seeing patients when they come back for their follow-ups. I got to see some patients today in their follow-ups, and I want to hear, what's the response been? What have your friends been saying? And the patients come back, and Judy comes back into the office, and she's standing a little bit taller, her shoulders are back, she's wearing brighter colors, dangly earrings. And she was telling me that she was driving with her son. She was telling me this car, she's smiling more. She's telling me this story. They got a flat tire. She's smiling. And they pull over to the side of the road, and another couple comes to help them. And as they were helping, they were talking to her son, and they asked her son, "How is your wife doing in the car?" And she loves being mistaken for her son's wife. And we're laughing about this and smiling, and she was telling me that she had been attending her church for many years. And now she's decided she was going to be a greeter for the very first time. "Hi, how are you? Welcome. So good to see you. Let me get that door for you. Come right in." Greeting people, giving them that energy. And it occurred to me that the energy that she was giving off was very different than when I first met her. Yet it was the same person. And now she just felt like she was blossoming. And it's so beautiful to see. It's always beautiful. And it is never too late to do the right thing, to invest in ourselves. Many of you have raised a family before. How many of you have raised a family? Who gets put first in family? The kids and everybody else. Who gets put last in family? That's what we love. It is your time. It's time to invest in you. So we're going to share with you what we can do. You've got our book. You'll see our before and after pictures. You'll talk to our patients. And before you leave, we'll do a one-on-one. Now, even though there's a lot of people here, what we do, so when we finish with the seminar, we'll start the one-on-ones, and I'll go from table to table. Okay? And my team knows how to put the plans together, and I come through and approve them. They'll bring the food out. We'll do a raffle drawing at the end. And at the very end, when there's 3 people left, we'll do another raffle for a VIP. We're raffling off a filler treatment, a facial filler. And the last raffle is a VIP red carpet facial treatment by Dana. Wonderful treatment. So there'll be prizes. And before you walk through those doors, you will have a plan for you. And if you need more of my time, we'll give you all the time we need. We just set an appointment up in the office. But this way you can know what's right for you. So we're really excited to share this with you. So that's Judy, and if we can do this for Judy, we know we can do special things for you. And we're going to go through questions at the end as well. Now this is Sally. Sally is a swimmer. She did laser treatment. She did image lift, and she looks natural. It's not overdone. Difficult to see the incisions. Looks natural. She brings donuts to the office when she comes in, so we love seeing Sally. This is Mary. Mary had been wanting to do the lift for 5 years. She came to a seminar very similar to this, and I asked her, "What is holding you back?" She said she could not get her budget or finances figured out, yet she had it done. So how is that? She could not get it figured out. She did a consult with our team. She was able to get it done. So Mindy, Janine, and Stephanie in the back, if that's what's holding you back, just let us know. You'll be amazed how flexible we can be. You only need one pathway to make it work, and we will explore all the different options to figure it out for you. If we did it for Mary, we can do it for you. Now, this next before and after that I'm going to share with you, I am very proud. It shows the latest technology. all of my experience, the power of Smile wrapped into one. I'm very proud to share this with you. Didn't we do a great job? Now let me ask you a question. Do you think that we ever have people that come to us and they want this kind of improvement? We have to have a talk with them. There's a limit. I asked that question at a seminar. One woman stood up, she says, here I am, I'm that person. That's actually my daughter when she was in 3rd grade. Now she's in 8th grade and she's going to be driving this year. Oh my goodness. She's a wonderful daughter. She's a great student, a great athlete. We can't go this far. We'll take things as far as we can. If we need to come back another day, that's better than going too far. Do you follow me on this? Right? Okay, good. And that's where the one-on-one is good, about setting the expectations. We don't want to be too hard on ourselves. Perfection is not a good thing in plastic surgery. People ask me all the time, how is it that people go so far? What happened? They seem like they had all this money or access to the best doctors. They would have had a better result if they came here first. That's the most important decision you will make, is who is taking care of you. Do you follow me on this? Okay, very good. So we can't go that far. We'll take things as far as we can. Melba is in her 70s. She was very active in clogging. She called these her Richard Nixon jowls. She did the lift. We did laser treatment. We did some fillers. We did upper eyelid. She did do a little tuck-up procedure. It looks natural. It's not overdone. It's difficult to see the incision locations. You will look natural. Okay? Jeannie is a nurse. We have a lot of medical personnel that come through because we do office-based procedures. People don't want general anesthesia. They don't want traditional facelifts. They don't want the cut across the forehead, the head through here. There's no surgical drains in what we do. There's no surgical staples. This is not a traditional facelift. It's not the old-fashioned procedures. So Jeannie came through, and then afterwards, one of her family members came through, and in their words, they wanted to get their turkey neck taken care of. That's what they called it. When people come in, their family and friends follow. Martin, he's a golfer out in the Villages. He was in the finance industry. And you see how the jawline is kind of, it's like drapery, draping down. As we get older, we lose bone, right? We get a little bit shorter, and on the face, there are prominences. The cheek prominence, the brow, the back of the jaw, and the chin. And as we get older, those prominences get a little smaller. Then the facial mask will sag over top. A lot of places don't even talk about this. We can build that volume back up to create that youthful appearance. Now for Martin here, we did the lift. And when we tighten up that sagging skin, see that little sunspot he's got there? Can you see that over here? It's tucked up right behind his earlobe, right in front of his earlobe, rather. Difficult to see the incision location. It fades very nicely. And there he is smiling. We always look our best when we smile. Mary came in. She did a lifting procedure. She got a big improvement. She was not satisfied with her treatment. So we came back and did an additional tuck for her. She's satisfied now. But notice she started with a lot. If we need to come back and do more, that's always better than going too far, right? Now her story was her grandson was 5 at the time, and what inspired her to come in, he would jump into her lap and give her a big hug and say, Grammy. He would take his little hand and reach up in here and grab her neck and pull it back and forth. She hated that. And now he doesn't have anything to grab onto anymore. When I do the image lift, there are 3 types of lifts that I will do. The image lift is the most. Under local anesthesia, you take relaxing medicine by mouth, numbing medicine like at the dentist office. We lift the skin, tighten the muscle, trim away the extra skin, right? There's physical versus social downtime. Physically, you get back into your routine in a day or 2. Errands, shopping, things around the house. Not 100%, but you start your activities. Socially, you pass the grocery store test. 7 to 10 days later, you walk into the grocery, nobody really does a double take. Some are a little quicker, some take a little bit longer, but in general, that's the image lift. Now, That's the most I will do. It is not a traditional facelift. There's a step below that. I call it the mid-lift. Psychologically, some people just feel they want a little bit less, or it's easier for their budget. So I call it the mid-lift, and that also tightens on your profile. Then there's the mini. There are some doctors, they will not do the mini. They don't think it's a good procedure, but it's a great procedure. I have so many patients that are happy with the mini. And the mini is correct if someone says, you know, I really don't care about this right here, but I like this. Then the mini can be great. So for Al, I said, Al, we probably should do the image lift or the mid lift, because notice, you've got this area here. He said, just do the mini. I'll be fine with that. Whatever you choose, I will go for the gold. I'll go for the best result possible. I did the mini for him, and he's happy, but notice, he still has a little bit under here. He's okay with that. But some of our patients, they would not be happy. That's why the one-on-one is so important, and we'll do that today with you before you leave. So we did the mini, and that was right for him. It's different for everyone. Do you follow me on this? Okay, very good. The lift, the image lift and the mini, all of those, they tighten the muscle. This is laser tightening, 1 day later, no stitches. The laser tightens the skin and it removes some of the fatty tissue. Our skin loses its elasticity. It's like the elastic band or the old sock. They get stretched out, doesn't fit so well anymore. This is laser tightening 1 day later. There's no downtime. This is 8 months later. Monica tightened the neck and jawline, and we did some fillers for the corner of the mouth. It looks natural. It's not overdone. She came on TV and demonstrated her results with us. Nothing compares with what the image lift will do. This is Nancy 1 year after the image lift. The image lift tightens the muscle, and it removes the extra skin, and difficult to see the incision locations here. And then I combine them. Judy did the laser to tighten the skin, the lift to tighten the muscle, and the lift to remove the extra skin. Laser image lift, tightening with the skin for the laser, tightening the muscle. Go ahead, put it on speakerphone. They're going to want to hear this. And so, Deb, she sends us a lot of patients. She's a fitness instructor. She's got a radio show. Laser to tighten the skin, lift to tighten the muscle, lift to remove the extra skin. RJ's an actress. She's in television. She's been in movies. Laser for the skin, lift to tighten the muscle, lift to remove the extra skin. Some of you have brought your photos when you're in your 20s. They're not mandatory, but if you've got them, you'll see how the aging process progresses with us, how volume changes. So when we're young, we're full of volume. Then as we age, we hollow, and those bony prominences start to erode, and the jowl. We did lift and filler for her. It's not perfect, it's better. If she wants to come back to do more, we can always do that, but it's a nice improvement. She's in her 70s. Katie is a nurse. She's a figure skater. She was taking great care of her body. She didn't feel like her exercise was doing anything for her face. Notice the back of her jawline, how full that is, and it fades away. The bone erodes away. Sagging with the jowl, we did lift and fillers for Katie. It looks natural. It's not overdone. Liz is 18 here she's in her 70s, full of volume. Hollow, lift and fill. It looks natural. Facial fillers. So the simplest no downtime option are facial fillers because they plump. They give you a little bit of lifting, but they don't replace what the lift will do. So this woman, she did fillers in the creases here, and there are 3 questions that you must answer for the facial fillers. Number 1, where? Most people come in and they say the creases or the smile lines and the cheeks. More advanced technique, we do the full face because we lose volume everywhere in the full face. So number 1, where do you want the filler? Second question, which filler? There's temporary fillers, there's permanent fillers, there's middle of the road fillers. How many of you here are aware that there are permanent long-term fillers? How many of you knew that? Most people aren't aware of those things. I have patients come to me, they're very frustrated. They said, I did fillers over at this other office. Nobody told me that there were long-term fillers. Once you do fillers long enough, everybody says the same thing. Don't you have something that lasts longer? And we do. The most expensive filler is the temporary. You have to keep replacing it. So, 3 questions with the filler. First question is where, second question, which filler, short-term, long-term, middle of the road. Third question, how much of that filler? Now some people talk about fat grafting. Fat grafting can do well, but most people think that, most patients, they think it's permanent. But when I talk to patients a year or 2 after they've had it done, say, how do you like your fat grafting? Most patients will say, I thought it was supposed to be permanent, but I felt like it went away. That's why the long-term fillers are a better option for many of my patients, because you don't have to do a procedure, there's no downtime. You may have some bruising, you can add fillers at any time, and it is a permanent filler, it stays with you. The Bellafill is 80% collagen and 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen, and the PMMA is non-absorbable. The FDA describes it as non-absorbable. The body does not have a way to clear it, it stays with you. And that's a more common choice for fillers. Now for this woman, she came in and she did the fillers, she liked her results. She came back 6 months later and she said, you know, I'm not satisfied, I think the filler is all gone. So we showed her before and after pictures, and when she looked at them, she says, oh, I didn't realize the lines were so deep before. There is a famous plastic surgery saying that after we do a cosmetic treatment, our vision will get better and our memory will get worse. You are going to analyze your face so closely after you do a cosmetic treatment, you'll notice one brow is a little different than the other. And the memory gets worse because we don't remember what we used to look like. It really is universal. I've had patients come through, and if they're frustrated with their results, the first thing I do is show them their pictures. I just saw a patient of mine, she's been my patient for almost 10 years, and she comes in and she says, how come you always bring up those pictures from the very beginning? She says, I hate to look at those pictures. I said, I just want to show you what a difference. She says, well, I really do have a nice difference there. But it's undeniable in the pictures. So the pictures help us. Our goal, I just want you to be happy, but the vision does get better, the memory gets worse, and we will keep you looking natural. Facial fillers, this is 7 syringes of fillers. It looks natural, it's not overdone. Some patients are satisfied with just 1 session. 7 syringes, and we also took the mole off of her cheek. Some patients, they're not satisfied until they do a second session. This gentleman did 2 sessions. We've won awards for our treatments. We're very proud of our results. 30 days, less than 30 days, 16 syringes of the long-term filler, the Bellafill, no downtime at all. And he's very happy. He looks natural. Laser treatment. If the wrinkles around the lips, if your lipstick bleeds into the wrinkles or you have sun-damaged skin, we can do the laser for that. My Aunt Shirley did the lift. She did a lift and a laser combination. And then Nina and Elisa remind me, I have a picture of Aunt Shirley now. We were at her grandson's wedding. And he just recently got married, and Aunt Shirley's daughter came in and she did her lift. And when you see her now, she's in her 80s. She was 76 in this picture. She looks wonderful. So Aunt Shirley came on TV and demonstrated her results, and we were talking with the host, and after we did this segment, she looked at her pictures and she said, you know, I don't remember having all those wrinkles before, right? The vision gets better, the memory gets worse. Phyllis called these her waffles. She said it looked like she fell asleep on a waffle iron. So we did the external laser, and we did the image lift to tighten. So it looks natural. So let me ask you a question. Have you seen some results that you've liked so far? Would you be happy if you had a result similar to what you've seen? You've come to the right place. This is what we do best. Now, one of the things that I found, I love seeing patients come through and hearing all of those stories. And really, this is about quality of life. Now, if you live in this area, you know what quality of life is about. How many of you are from up north? Do we have to ask why you moved down south? Is your quality of life higher here in the south versus the north? You're missing out on all that cold weather. When we live up north, we move down south, and our quality of life, it goes up. When our faces start to go down south, you just lift it right back up north, and your quality of life, it goes up. This is also about, we get into patterns. You ever notice how people go on autopilot, right? For example, when we're driving, you ever have the experience you're driving in your car, you get into your driveway, and you can't remember the past 5 or 10 minutes you've been driving because you're on autopilot? I hope I didn't run that stop sign, right? Or we put clothes in the car and we're gonna drop it off at the cleaners on the way, right? What do we do as we're driving? You go right past, because we're in a pattern. We're on autopilot. Now, most people, interestingly, we have an autopilot when we look into a mirror. And that's my job, to watch people while they're looking at themselves in the mirror. When we look in a mirror, we tend to look at the exact same places we always look at, usually in the same order, autopilot. We tend to say the same things to ourselves. When did I start looking like my mother, a father, a brother? And it tends to make us feel the same way. Some of my patients, they tell me their pattern when they approach a mirror, they don't even look. They just get their hair ready, they get ready, and they move on. They don't look because they don't like how it makes them feel. So I want to ask you, this is Dale. What do you think her pattern was when she looked into the mirror? What did she focus on? What did she say to herself? And more importantly, how did it make her feel? Dale came into the office. She did a laser image lift procedure. She came to seminars like this. She made her decision. She did a laser image lift. We did fillers in the cheeks. We did eyelid treatments. Do you think she had a different pattern after her lift? What does she focus on now? What does she say to herself? And more importantly, how does it make her feel? Dale never felt the same way about herself again. She came to so many of our events. She would share with people her experience. Everyone's experience is different. I am sad to say Dale is no longer with us. She was diagnosed with a condition. She passed very quickly. She's a great smiler, and she's an inspiration to all of us to live for today. And she broke her pattern. Her life was never the same again. And such a wonderful person. We're so grateful to have known Dale, and she made a very big impact on us. Everything in life evolves. If you told people 30 years ago what these cell phones could do today, what would they have said to you? It's not real, it's magic. But not only is it real, these devices, in a few years, they're going to be outdated. What else has evolved? Have grandparents evolved? What were grandparents like 30, 40 years ago? Grandparents today, they're athletic. They're living longer. They're raising their grandkids. Many grandparents are still working. They're hip. Plastic surgery has also evolved. The results are better. It's safer. It's more affordable. There's never been a better time to do a cosmetic treatment. The training is better. That's why we're so excited to be here and share with you the future of plastic surgery. And this is the future of plastic surgery. Sherry is here today. She did an image lift procedure. She'll tell you about her experience. She did a mid version. She looks natural. It's not overdone. Bev comes out to a lot of our events. She did laser treatment for the face and a little tuck with the laser. She's done a little bit of additional laser since then. It looks natural. You don't want to go overboard. Jen sets up a lot of our events. She's done a lifting procedure as well. You must look natural. Linda's here today. Full of volume, aging changes. We did the lift and the fill. Nancy comes out to a lot of our events. She did a mini. The mini was the right thing for her. She likes it. And notice her jawline. You see how it sharpens the jawline, right? You must look natural. So, if you see results that you've liked, at this point in the conversation, then the question, some of you will say, I'm ready to go. You place a deposit that locks in your pricing, locks in your date. We go through the pricing. The pricing depends on what you choose and what you need, so we'll go through that today in the one-on-one. But if you feel something's holding you back and you see it up here, just let us know. You'd be amazed how flexible we can be. The most common thing we may hear is people say, it's my finances. I've got commitments. How do I make this work? We figure that out for you. You'd be amazed how flexible we can be. If the finances hold you back, just let us know. We can figure something out for you. Or maybe your schedule's just so busy. You've got mahjong, pickleball, you've got clubs, you've got crews, people coming in from out of town, family. If you have no downtime, we will figure out a treatment that fits into your schedule. Some of you say, well, I'm allergic to fear. My niece was 3 years old when I got the phone call that she fell and she had a gash in her forehead. So we brought her into the office, I numbed her up, we did the stitches. She did not shed one tear. And I promise you, if we can make her feel comfortable, will make you feel comfortable too. And you can have a lollipop too if you want. We'll take the fear out of it. We broadcast our procedures live. With permission, of course, we do teaching. We have had hundreds of thousands of people watch our procedures live. No filters, no editing. We obviously feel very confident in what we do, but we do it as a teaching tool. And we're proud to share that. And patients that participate in that say, I really enjoyed that because I heard you teaching and I would not have thought to ask that question. You are going to get options here that you are not going to get in other places. That's why it's so important for us to get out and share the message. So we'll take the fear out of it. Some people say, I'd love to do that, but that would be so selfish. I've got these commitments I've got to make good on, and I've got family I'm supporting. Being selfish is being smart when you do it the right way. And we love giving to our families, and we're not going to stop doing that. But can we really give to our families if we feel like we're dragging on empty? We're just, But if you fill yourself up, you do something that makes you feel good. When you invest in yourself, you have more to give to your family. And you're also teaching them a very valuable lesson of what it's like to invest in yourself, because they will follow suit. If you invest in yourself, they will learn that, and they're much more likely to do that. And if we drag along on gas fumes and we're running on empty, they're more likely to follow that example. We cannot pour from an empty cup. Invest in you. You are the most important person you'll give to, and we will keep giving to our families. Being selfish is being smart. Now, what are your family and friends going to say? Are they going to talk about you behind your back if you do a cosmetic treatment? They're going to talk about you no matter what you do. You might as well enjoy yourself and do what's right for you. Now, this is what we talk about during the consultation. We start out with, what are your areas of focus? Now, some people say, well, you're the expert, so you tell me what I need. And I will tell you what's common and what's popular amongst our patients. But it must start with you, where your focus is. Then after I hear that, I make some recommendations, but I'm watching you to see how you respond. And we customize the recommendation. And based on our conversation back and forth, we put a plan together. I cannot tell you how many patients that I've heard is that they've gone to so many consultations and they did not feel a connection. They did not feel that they could communicate effectively. You must have great communication. This is customized. This is not cookie cutter. So it starts with, what are your areas of focus? What is in your heart? Sometimes people can feel a little overwhelmed, like there's too much to consider. Like, you can simplify that. Just ask yourself, what do you feel in your heart? What's important to you? Your heart will tell you. Your heart will say, I want this. I want it. Here's what I want to treat. Go with that lead. There is an energy in every single one of you in this room today, right now, that brought you here. There are so many places you could be, and it is not easy putting an event on like this to get people to come. But why did you come? Because you have an energy that's on the inside. It's in your heart, and whatever that energy is, we're here to satisfy that. And that's what we do best. What's in your heart? What else have you tried? Have you done a cosmetic treatment before? And did it help you? It helps us get perspective on what's right for you. Do you have downtime, yes or no? And based on your schedule, we'll put something together that fits for you. So that's what we talk about during the consultation, and we'll do that today before you leave. Safety first. The image lift is an office-based procedure. Risks involved, we minimize that as much as possible. Bleeding or fluid collection, we handle that in the office. Infection, we put you on an antibiotic. Damage to surrounding structures, risk of a weak lip or eyelid is uncommon, and that's rare that would be permanent. It's less of a risk in a traditional facelift because we stay more superficial in an attempt to avoid that. Sometimes a deep stitch we put in can come out of the skin like a splinter. If that happens, that's easy for us to take care of. Everyone's face has asymmetry. My right eyebrow sits higher than my left. I tell all of my patients, your face will still have asymmetry afterwards. That's what makes us look natural. Now, the healing process is unpredictable. Most people heal just fine. There are some people that choose to do a touch-up or an additional treatment, may generate an additional expense. That's more the case. If someone comes in like we showed earlier, if they've got a big neck, we do a nice procedure and clean things up, they get a little relaxation. They want to touch up, it can cost more money. And then during the one-on-one, we will tell you your risk for that is low, medium, high, whatever the case may be. Now, because we do everything in office-based procedure, it's done under local anesthesia. So the risk that someone has to go to a hospital, have a heart attack or stroke is rare. And we do this by design, it's for safety. And that's what most patients want. Most patients do not want to go to the hospital. They don't want to go to a surgery center. They don't want to have general anesthesia. So that's the way we do things. Now, with the fillers, what are the risks for the fillers? Our risk of undercorrection. If we undercorrect with the filler, you can always come back and put more in. Better to come back another day rather than go too far. Risk of overcorrection. We're not going to overcorrect you with what we do. If you do overcorrect, you can fill the area around eating things out, but that's why you want an expert injector. Risk of lump or bump formation is uncommon. If that happens, it's treatable. Most people feel the filler. They say, I know that filler's there, but I don't feel it. I know it's there, I just don't feel it. Some say, well, I do feel something, but I don't see it and it doesn't bother me. I'll leave it alone. Rarely do I make an incision to take a nodule out. So what's my strategy? Use a small amount over a large area to minimize or eliminate your risk for that. I use a safety cannula for most of my injections. What is a cannula? It's basically a soft needle. Less bruising, less trauma, safer. The risk of getting that filler into a blood vessel, causing scarring, loss of vision, damage to surrounding structures is rare. Again, that's why you want an expert injector. In many offices, they let the nurse do the injection. We set ourselves apart. This is the surgeon doing the injection. I'm the #1 Bellafill injector in the United States, the #1 Radiesse injector in the Tampa Bay area. We do a lot of these fillers. You just look at our reviews online and you'll see. So safety first, and we're very proud of our track record. Now, we're going to go through, when you place a deposit, that locks in your pricing and it locks in your date. So for the image lift procedure, when you place a deposit, Mindy, we're doing $1,000 off an image lifting procedure when you place a deposit during the day of the seminar. We like to reward people who take action. We love getting referrals, and we have discovered that you should never tell your family or friends that they need to see a facial plastic surgeon. It just doesn't go over well. So instead, Dana's here. Raise your hand up, Dana. Dana's our amazing esthetician. Give Dana a hand. She does such a great job for our patients. Just tell your friends they can call the office and they can set up an appointment with Dana, and she'll give them a free facial mask treatment. No charge. And then we'll have to talk with them. That way you didn't have to tell them they need to see a facial plastic surgeon. Takes it, puts it on us, all right? So we love getting referrals. We get referrals almost every day. So we're going to go through questions, and then they're going to bring the food out. We'll have our models come up. What questions can I answer about what we've talked about so far? Yes, go ahead.
How long do the procedures last?
How long do the procedures last? So when you do a lifting procedure, it's like getting 5 years or 50,000 miles out of your tires. It depends on how you drive your car. So with the image lift, people typically wait 5 to 15 years before they say, maybe I'll do another tuck. Some may come back after a year or two. Some may wait 20 years. We go through weight gain, weight loss. We go through stressful times, illnesses. We can have growth spurts. We can have aging spurts. So in general, people tend to wait 5 to 15 years before they say they're ready for another lift. It's a range, and then it behooves you to take as good a care of yourself. Sunscreen, sun protection, skin care, keeping up with the fillers can get you the best longevity on your result. Thank you very much. Yes, another question. Any other questions? Yes, go ahead.
Are you familiar with a product called Genu, Genu? It's like you put your moisturizer on and then you rub it on. What do you think of that?
So there's a lot of different products, and they have many different names, and there's different stimulating devices that tighten, and you can do them at home. If they work for you, great. Patients come to me when they want to see more results than what they can achieve. So there's so many of them out there, and if you want to try it, the only risk is that it just may be the cost of it. But typically people come to me when they want to see more results than something like that. Usually the results are very mild. Some people say they didn't see much of a result from it. Thank you very much. Yes, we'll take a couple more questions. Yes, go ahead.
What is the name of the fillers?
The name of the fillers is I can inject any filler available, right? There's hyaluronic acid, which is more temporary. There's Radiesse, which is calcium hydroxylapatite. That lasts about a year to a year and a half. Sculptra is a gradual filler built up over time, lasts 2 to 4 years. Bellafill is not absorbed. It stays in the body. The collagen gets absorbed and replaced by our body's own collagen. So any filler you want, I have access to it. Thank you very much. Take one or two more questions. Yes, go ahead.
Generally speaking, what is the downtime?
The downtime to an image, that there's physical versus social downtime. So physically, you get back into your routine in a day or two, errands, shopping, things around the house. Socially, we pass the grocery store test. With the Mini, it's 4 to 7 days. You walk into the grocery, nobody really does a double take. With the Image Lift, 7 to 10 days. And you can go see our videos online. You can watch me do the procedure. Patients say, wow, I felt so comfortable seeing how you made the patients feel comfortable. So you can see me do the procedure, but that's the general rule of thumb for downtime. Some are quicker, some take a little bit longer. Thank you very much. Yes, we'll take one. Yes, go ahead.
So how long will the eye drop filler last? The longest filler that you have now?
So we do have a permanent filler available, and you can inject it in different areas in the face so it stays with you. Now, aging keeps coming. If we're lucky, aging keeps coming. So the goal is prevent, give you as much improvement as possible. Allergy symptoms can also affect what happens in the cheek and tear trough area. So we go through all that in the one-on-one, but the result does stay with you, but we want to make sure we do the things that give you the best longevity, whether you're taking other medicines, doing treatment for allergies, it depends on the person. Thank you very much. It's a good question. Yes, one more question.
What happens if you're allergic to the filler?
What happens if you're allergic to the filler? So first of all, you can be allergic to anything, but it is very rare that you have a sensitivity to these types of fillers. The long-term filler, there's a collagen skin test that you can take to see if you have a sensitivity to that. It's very rare, and if someone has a lot of sensitivities and allergies to different medicine, I will treat them differently than I would. But many of these fillers, calcium hydroxylapatite, that's already in our body. We're not allergic to it. Hyaluronic acid, it's already in our body. We're not allergic to it. So there's different options depending on your allergy history to make sure you have a safe experience. Thank you very much. So what we're going to do now is, let's see, Linda and Marty and Shirley, you want to come up here and talk? Let's give our models a hand today for coming out. And go ahead, Shirley, we have Shirley and Sherry today. So we'll start with Sherry. Sherry comes in, some of our patients don't have any family or friends in the area, and if they want to do a treatment, Sherry and Beth, they get together and drive them or stay with them. Not everyone needs that, but if you do, they do a great experience for them. So Sherry, can you tell us, what was it that inspired you to have a cosmetic treatment?
Well, I retired my whole life. I really wanted to grow old gracefully. And it wasn't working when I retired because I felt so young and so fantastic. I was like older by the day. And I am an image consultant. I made people over for a living. And it wasn't working for myself. I couldn't do anything. So I was sitting where you were sitting 4 years ago. And I saw all these pictures. I said, you know, I think you can really help me. So I went ahead and had a medium lift done and loved it. I feel like a new person. And I don't tell everybody that I've had it done. My daughter will never, ever, ever know. But anyway, it's a wonderful thing, and he is great.
Thank you so much. Sherry, can we share with them how young you are?
Yeah, I'm 70.
Thank you so much. So Marty is a family friend from many years ago. Marty worked in my brother's dental office, and that's how we first met. And when she found out what we did, she came in and did a lifting procedure. So Marty, can you share, what was it that inspired you to have a cosmetic treatment done?
I met Dr. Castellano. I had seen a TV advertisement for what he did. When I was working one day, he came running in, and I was like, oh my God, this is fake. So I was in my 60s. I had been taking care of everybody my whole life, and I decided it was time for me to do something. So I went to see Dr. Castellano. It's been the best thing I've ever done. It makes me feel great. I feel so much better. It made me a better caretaker for my son. My son passed away, and I went back to see Dr. Castellano about 4 years ago now, and had a little bit of a pick-me-up is what I call it, because it certainly picks me up. And he's the best. He makes everything so much nicer. So.
Marty, can we share with them how young you are?
73.
73. Marty. And Shirley. Shirley didn't know she was coming up today to talk, but Shirley, how long ago was it, Shirley, that you did your lift?
I'm 9 weeks out.
She's 9 weeks from her procedure. What was it that inspired you to have a treatment done, Shirley?
I started out in this quest 10 years ago. I have seen 2 other plastic surgeons,
one was more interested in money, the other was a great surgeon. I love him to pieces, but I didn't like his method, which was to put me in a hospital setting and put me to sleep. This is the third seminar of yours I've been to. Pretty soon, I'm gonna have a collection of these books, and I can start.
What has the response been from your family or friends?
Well, I'll tell you, I had surgery on Wednesday. I took my last extra strength Tylenol on Friday. Monday of that next week, there was 28 of us that went over to Bayport to eat. And nobody could tell I had anything done, but I kept getting some weird looks. And finally I realized, okay, they're looking at me strange because I had two little blue pieces right here. I said, no, Charles did not whack me. He did not knock me down or
You
whatever.
got a little bit of bruising.
Yeah, just like. But I have no more turkey neck, and I can tell you that Dr. Castellano and his staff will be with you pre-op, during the surgery, and post-op. And there is nobody any better that you can communicate with than this gentleman right here.
And here's Linda. Linda and her husband David, they just celebrated their 50th anniversary not too long ago. You come up with your hands up. So Linda, what was it that inspired you to have cosmetic treatment?
I look like my mother. I'm 68. I had my procedure done January 7th of 2015 at 66. I chose Dr. Rich because he only does faces. That's very, very important because you do something with a doctor that concentrates on something very specific. I chose him over all the others because of that. I love getting up every morning and looking in the mirror. I don't have any makeup on then, and it's wonderful. I do this, and then I look this, and I look this, and I look this, and it's a wonderful feeling. Do it for yourself. It's a wonderful feeling, and they are wonderful. The whole office, and he is.
Thank you so much. Thank you, ladies. It's so wonderful to hear from our patients. We love them so much, and they're a part of the family. So we are excited to speak with you and go through things for your specific plan. So what we're going to do now is they're going to start to bring the food out in just a moment. We're going to do the raffle prize. So what are we raffling off today, Janine? This is one syringe of Radius, and if you walked in, you got registered. Everybody got registered. So we pick, everybody got, as soon as you walked in, they put everybody here in through I Promise. And so this one feels very lucky here. This says, it says, Jackie Frank. Jackie, there's Jackie, our lucky winner. Jackie, all you have to do is just call the office and set an appointment, and we'll take care of you. Free syringe of Radius. Congratulations to Jackie. We're doing one more raffle when there's just 3 consoles left to see near the end for the red carpet VIP peel with Dana. You will love it. So ladies, Nina, I think we're ready to seat the first console. I'll take care of that, that's fine. So what we're going to do is they're going to start seating you at the tables. They'll bring the food in. You'll be able to get your questions answered. You can go through the books. Thank you so much for listening. We choose you to smile more because everything worthwhile starts with the smile, and we're so excited to share and see your smiles. Thank you so much for coming out today. I look forward to talking to you. Thank you so much.